This is Lab 6 regarding blood and heart anatomy. What is the blood? Blood is a tissue or an organ. If you think blood is a tissue, your answer is completely right. But what kind of a tissue can be blood? Blood is a connective tissue. So in the blood, we can find plasma, the liquid part, and formed elements. So blood composed of plasma and formed elements. The formed elements composed of red blood cell or erythrocyte, that they are the most abundant cells in our blood. And then we have the white blood cell. They are very larger than red blood cells. And then at last we have platelets. So platelets are the cell fragments. Let's see these tests when we want to see the composition of blood. So as you can see, after centrifugation of blood at the test tube, we can find 3 different layers with 3 different colors. The heavier part, that is red, is composed of erythrocytes, and it's 45% of whole blood. And then at the top, the lighter part is plasma and is 55% of whole blood. But between this top layer and bottom layer, between red and yellow, there is a thin layer of white color. Actually, this part, we call this as buffy coat, and it's less than 1% of whole blood. The buffy coat composed of leukocytes or white BC and platelets. But we should see a blood under microscope. If you look at the blood under microscope at the low magnification, you can see a picture like this. So these small roundish pinkish cells are red blood cells. Red blood cells are the cells that they are responsible to carry oxygen, and they don't have any nucleus and organelles. So finding the red blood cell are so easy because they are the most abundant cell that we can find in the blood. And then the platelets are so small. They are very tiny because they are cell fragments. So finding platelets is easy as well. So they are kind of very tiny purple dots. And then the last elements are white blood cell or leukocytes. So when you find a cell, a big cell, large cell with a nucleus, these should be white blood cell. But there are 5 different types of white blood cells. They differ in size, shape of nucleus, and staining characteristics. So the leukocytes with granular cytoplasm are called granulocytes, and the leukocyte without cytoplasmic granules are called agranulocyte. So we can divide our leukocyte to 2 categories: granular leukocytes and agranular leukocytes. So granular leukocytes, we have eosinophil, neutrophil, and basophil. Look at these cells. So let's start with the neutrophils because they are the most granular leukocyte, or they are the most white BC that we have in our blood. So look at their cytoplasm. At their cytoplasm, you can find light purplish granules. Look at their nucleus. So they have lobed nucleus. So their nucleus can be between 2 to 5 sections. This is our neutrophil. And also this one is a neutrophil as well. This is a young neutrophil because its nucleus it has just 2 sections. And this is gonna be the eosinophil. Between 2 to 4% of white blood cell can be eosinophil. At first, let's look at their cytoplasm. Their granules are deep red or deep pink, and their nucleus is bilobed, or it has 2 sections. So this is our eosinophil. And this one, these cells that you can see, it has deep purplish granules. These granules kind of mask their nucleus. Is called basophil, and is the at least white blood cell that we have in our blood. So these three, neutrophils, eosinophil, and basophil, are the granular leukocyte. So neutrophils with lobed nucleus. Their lobe nucleus can be between 2 to 5 sections, and their cytoplasm has light purplish granule. Eosinophil, the nucleus is bilobed and they have red or deep pinkish cytoplasmic granule. And the basophil, they have the dark granules in their cytoplasm that it's gonna mask their nucleus. Let's see what are the agranular leukocyte. There are two agranular leukocytes. We have lymphocyte and monocyte. Lymphocyte are 20 to 25% of the total white BC, and the monocyte are 3 to 8% of the total white BC. Look at monocyte. Monocyte are the largest blood cells, and their nucleus is kind of kidney shaped or bean shaped. And the lymphocyte, it can have two different sizes. Some of them can be very large, some of them can be just a little bit larger than red blood cell. But their nucleus are round and large, and you can see a rim of cytoplasm around the nucleus. Okay, as you can see in this slide, so we have 5 different type of leukocytes: neutrophil, eosinophil, basophil, lymphocyte, and monocyte. The eosinophil, neutrophil, and basophil, they are at the category of granulocyte, and these two, lymphocyte and monocyte, are the agranulocyte. Okay, so they say never let monkey eat banana. N stands for neutrophils. They are the most abundant white BC. L stands for lymphocyte. So the second most gonna be lymphocyte. M stands for monocyte, third one. E stands for eosinophil, and B stands for basophil. So the at least white blood cell are basophil, and the most gonna be neutrophils. The next is to study heart. Cardiovascular system composed of heart and blood vessels. Heart is a pump that can send the oxygenated blood to the body and also receive deoxygenated blood from all part of our body. And for blood vessels, we have artery, vein, and capillary. Artery's definition, it means that it can go away from the heart, and vein is the vessel that bring blood to the heart, and capillary are the tiniest vessels that exchanges of gases gonna happen at the capillary. Most of the arteries carrying oxygenated blood, but there are some exceptions as well, and most of the vein carrying deoxygenated blood, and also there is some exception for vein as well. So let's look at the heart. We can divide our heart to two sides, right side and left side. Right side receiving deoxygenated blood from our body, and left side receiving oxygenated blood from our lung. So, and also we can divide our heart to each side to two chamber. So the superior chamber, we call this as atrium, and the inferior chamber, we call this as ventricle. So in this way, we have 4 chambers at heart. We have right atrium, left atrium, right ventricle, left ventricle. So right atrium, it contains deoxygenated blood. Right ventricle contains deoxygenated blood. Left atrium contains oxygenated blood, and left ventricle contains oxygenated blood. Okay, so let's see where this deoxygenated blood or dirty blood comes from. This deoxygenated blood comes from head, neck, upper limb, lower limb, abdomen, thorax, and pelvic to the right atrium. So all of this area gonna send their dirty blood to the right atrium. Okay, so for this matter, there are two major veins. The superior vena cava, it bringing dirty blood from head, neck, and upper limb, and then the inferior vena cava bringing dirty blood from lower limb, thorax, abdomen, and pelvis to the right atrium. The next step for this dirty blood is to go to the right ventricle. There is a valve between right atrium and right ventricle that we call this valve as right atrioventricular valve or tricuspid valve. So the dirty blood from right atrium goes to the right ventricle through passing of right atrioventricular ventricular valve. Okay, and then there is a vessel that this vessel gonna bring the or send this blue blood or dirty blood to the lung, because lung is the organ that it can refresh this dirty blood. So this vessel is going away from the heart, so we should name this as artery. So this is an artery that carry deoxygenated blood. We call this as pulmonary trunk. So pulmonary trunk is an artery. It comes from the right ventricle, go to the through the lungs, and it carrying deoxygenated blood. So very soon this pulmonary trunk gonna divide to two branches, and one is gonna be left pulmonary artery, it goes to the left lung, and right pulmonary artery that it goes to the right lung. And then from the lung, from each lung, two vessels bring oxygenated blood to the left ventricle. So it should be artery or vein. This is the vessel that bringing blood to the heart, so we call this as vein. So they are pulmonary vein, left pulmonary vein and right pulmonary vein. Okay, so as you can see, 4 pulmonary vein from the lungs bringing oxygenated blood to the left atrium, and then between the left atrium and left ventricle there is a valve. We call this valve as left atrioventricular valve or mitral valve or bicuspid valve. Okay, so then this oxygenated blood goes to the left ventricle, and then we have a very large and important vessel that it goes away from the heart, and it calls aorta, and it carrying oxygenated blood throughout our body. Okay, so but let's look at this picture. This is a picture of heart from the you can see the external surface of the heart. This is the anterior view. Okay, so at the anterior view you can see this part is called right atrium. Okay, then we have the right atrium, left atrium. Actually, as you can see, this part is like is a structure, look like an ear. That's why we call this structure as auricle. So this part, better to say auricle of right atrium, and this one is auricle of left atrium, and this area should be the right ventricle. So this part is right ventricle, and this part should be left ventricle. So as you can see, left ventricle is a little bit larger than a right ventricle because it's gonna pump the blood throughout our body. So that's why it should be kind of bigger. So left ventricle. So we have here we have auricle of right atrium, auricle of left atrium, right ventricle, left ventricle. So we can say that the heart is like a triangle, that it has a base on top as it has an apex at the bottom. So the apex of the heart is actually the left ventricle, part of the left ventricle, and at the base we have major artery and veins that they're gonna go away from the heart or bringing blood to the heart. So from the anterior surface of the heart you can see these structures. And also you should know the name of these vessels. Okay, so this is gonna be the vessel going away from the heart. We call this as pulmonary trunk. So pulmonary trunk very soon is gonna divide to two branches that we call this as left pulmonary artery and right pulmonary artery, going to the left and right lung. And this one is the superior vena cava, bringing deoxygenated blood from head, neck and upper limbs, and this is the inferior vena cava that bringing deoxygenated blood from our abdomen, thorax and lower limbs. And then you should know these left pulmonary veins and right pulmonary veins, they are coming from the lung and drain oxygenated blood to the left atrium. This picture is the picture of posterior view of the heart. So at the posterior view it's better to see the atrium. So this is the right atrium and that one the left atrium. How do I know this one is right, that one is left? Okay, look at the apex. The apex, I mentioned that apex is more left ventricle. So when we have apex right there here, so this part should be left. So this is the left margin of the heart. So this should be the left atrium. So this should be the right atrium. Okay, so we have right atrium here, left atrium here, and also you can see these right pulmonary vein, left pulmonary vein. These are the right and left pulmonary vein, 4 pulmonary veins coming from lungs, and this is gonna be a superior vena cava, and this is the left pulmonary artery that going to the lungs. Okay, so if we look at the coronal section of the heart, you can see here is the right atrium. This is the right ventricle, left ventricle, left atrium, and this is the valve that we have between right atrium and right ventricle. We call this a tricuspid valve or right atrioventricular valve, and this one should be the mitral valve or bicuspid valve between left atrium and left ventricle. And then you can see here the heart has a muscular wall, and this muscle we call them as papillary muscles. These are the papillary muscles that some structure like strings from the valve attaching to the papillary muscles. Okay, so these strings we call them as chorda tendini. So chorda tendini are the structure that connecting the valve, atrioventricular valve, to the wall of the ventricle through the pulmonary muscles. And also here you can see the chorda tendini. So this part is chorda tendini, and we have the papillary muscle here. Okay, and then you should know that the aorta has let me just try aorta. So this is the aorta. that the aorta coming from the left ventricle. Just imagine this is, if this is our heart, we have right atrium, right ventricle, left atrium, left ventricle. This aorta comes from the left ventricle. So when it goes out of the heart, we call this part as ascending aorta. And then it has a structure like arch. We call this as aortic arch. And then it comes down. We call this as descending aorta, this part. From the ascending aorta, there is two artery branch off from the ascending aorta to the heart. This is the coronary artery, right and left. The coronary artery is going to supply the heart itself. Okay, so this is coronary artery left. And then from the aortic arch, we have three branches of artery. The right one, we call this as brachiocephalic trunk. The middle one, we call this as the left common carotid. And this one, we call this as left subclavian artery. So let's look at here. Here you have the brachiocephalic, left common carotid, and right, left subclavian. And also you should be able to name the all parts of heart at the shape model that we have. Left ventricle, apex, right ventricle, right atrium. So at first you should know, is it the anterior surface or posterior surface? If you see the let me see, yes, this should be the posterior surface, because the anterior surface you can see the pulmonary artery. Let me show it to you if I have a picture here. No, this is not a picture that I wanted to show you. So this is the posterior surface. So for example, here you can see the pulmonary artery is the anterior-most structure. So this should be the anterior surface. Or when you see the auricles, it should be the anterior surface. So here, the auricle is not obvious here, so this should be the posterior surface of the heart. Okay. And also you should be label the all parts of the sheep heart on the pictures. And also there is a connective tissue surrounding the heart that we call this as pericardium.